come and share with us his knowledge about oral hygiene. Thank you so much. Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you so much, Sheikh Hassan. My name is Baluku Aiman Hassan, doctor, pursuing dental surgery in Uganda, and inshallah next year I'm going to be graduating. So I'd like to say thank you so much for coming for this lecture. We're going to talk about oral hygiene. Oral hygiene, people take it in different perspectives, but oral hygiene is very wide. So out of the whole topic of oral hygiene, I picked out something small called dental caries. So inshallah, the very first watch one video, then I can proceed. Okay, thank you for watching. I'll begin by posing a question to the house. Do you think it's very important to have healthy teeth in your mouth? After watch the video, is it very important to have healthy teeth in your mouth? Really? Okay. So most people usually don't know why we have the teeth. Okay? But according to that video, they have highlighted some advantages of the teeth that you have in the mouth. About the teeth, we have very many importance of the teeth, as you've seen in the video. But one of the most important importance of the teeth is your face. The face, the looks of the face, the bones in the mouth are all brought up by the teeth. So if you lose some teeth when you're very young, then definitely you're going to look old. You may look 40 years when you're 20 years. Why? You have lost some teeth in the mouth. So most people are not taking good care of their oral hygiene. Why? One, it's because they don't know how to brush their teeth. Okay? We have grown up, but if you ask any one of us who taught you how to brush, no one taught you. You just woke up and your parent was doing like this, so you're also doing like that. Okay? So everything in life, we need to learn it from someone who knows it better. Like you want to drive a car, you need to learn it from someone who knows it better. Sometimes the way we are brushing our teeth is the cause of the problems that we get. Okay? We're using a wrong technique to brush our teeth. In the long run, we get problems with our teeth. So we're going to look at dental caries. As most of us know dental caries, others know dental cavities, something like that, dental decay. This is the same one, but usually scientifically, we call it dental caries because of a lot of reasons. The word carie does not only mean that hole that comes in the tooth, but also the causation of the hole in the tooth. So we define the dental caries, which you may call dental decay. It refers to a complex and dynamic bacterial disease that involves demineralization and remineralization of the inorganic substances and destruction of organic substance. So it is a complex. Why is it a complex? The possession of this dental carie takes time. Okay? Besides the time, a lot of factors are involved in the causation of the dental carie. Not only what you eat, but even your lifestyle is one of the ways that can affect your teeth. That's why we call it a complex. So we look at remineralization and demineralization. Remineralization simply means taking in the minerals from the foods that we eat and the drinks, and demineralization is loss of the minerals from the body through the activities that we do in our day-to-day life. So we can look at that. It's so familiar to most of us. We have seen something like this in someone's mouth or even in our mouth. This is the first case. That one. So when I'm talking about a dental carie, I'm simply meaning this, or this one, or something that looks like this, or something that looks like this, or this one. So at least you've seen any of these scenarios in someone's mouth. So imagine you're looking like this. You're not going to smile to the people. You're not going to say anything to the people because you feel they are going to laugh at you. They're not going to take you serious. Okay? You'll be delivering good message, but someone is busy looking at your teeth. It's like, no, if you cannot take care of his teeth, then why can they deliver this good message? So these are the dental caries, and most of us will have this. So this tooth, to reach that stage, it takes a lifespan of 3 years. By the time you start feeling that you have a tooth that is failing in your mouth, it has taken 3 years. Why? Because this causation of dental caries, it's an acid reaction. Okay? So what causes dental caries? It's just an acid reaction. A reaction between the foods that we eat, which are rich in sugars, and the bacteria that is already in our mouth. Okay? So as you can look at that, so this one medically we call it tooth anatomy. So when you look at our tooth in the mouth, it has what we call the enamel, the dentin, and the pulp. These are the major parts of the tooth. Usually, in our mouth, if someone opens their mouth, we will see from here up to here. Okay? So from here up to here, it's inside. So the time that the carry takes to leave this place here, just make a small depression. It's almost 3 years. So you may think like, no, I take good care of my teeth, but there's a care developing. Now, because in the Gulf region, the kind of water that we're using has much fluoride, and fluoride is very important in the prevention of dental caries. That's why you may take longer than 3 years, maybe 5 years or 10 years. Why? Because your teeth are very hard due to the fluoride that you use in the waters that are in the Gulf countries. So you may be like, no, mine has not taken 3 years, or it took more than 3 years. So the reason, one of the reasons, is the water that you use in the Gulf countries, which has a lot of fluoride. And also we're going to look at how bad is the fluoride that we use. We may be using too much fluoride. Some of us have been told by some dentists and doctors, don't use toothpaste that has fluoride. Okay? Don't use this toothpaste. This one has fluoride. I've seen even some toothpaste in the market, they write there, no fluoride. Yes, it is an indication, but indication for who? As we shall see. So, you can see that, that's a cross section of the tooth in the mouth. So, this is the nervous supply from this. When you look at the whole tooth in the mouth, it's only the mouth that has direct contact to the blood supply, not any other body parts. That's why anything else, any disease, usually shows first in the mouth. If you have HIV, we shall detect from your mouth. Even before testing you, we shall know this person has HIV. Okay? We can detect cancer from your mouth. Why? The mouth, as we may call it in scientific terms, or cavity, it's the only body part that has direct contact with the blood supply. It's from the mouth. If you don't take good care of your mouth, you can easily get stroke. Why? This area has direct contact with the blood supply. And as we have seen in the video, that tooth, it's not a bone, but it's the hardest part of the body. But it's not a bone. And it's the only part of the body that does not regenerate, and it's the only part of the body that does not do its self mechanisms to treat itself. Other body parts, maybe you get a cut on your hand, you may not take any medicine, you may not apply anything, but the cut after some time it is going to disappear, unlike for the teeth. So we have to take good care of our teeth so that avoid such problems. This is the process that we undergo in our mouth so as to get dental caries. The first is the bacteria. The bacteria is already in our mouth. Okay? Allah subhanahu wa ta'ala created us with other creatures also. The way we also feed on the camels, on the sheep, and the others, even these bacteria are creatures of Allah subhanahu wa ta'ala, but they are living in our bodies. So they benefit from the food that we eat. But if the food brings an environment that is not conducive for them, they will react, they will become bad. Okay? But they are good bacteria that are living in the body. So we call them normal flora in the mouth. Okay? They play very many parts, but when you put conditions in the mouth that are not favoring these bacteria, they are going to affect you. Which conditions are these? Sugar. So this bacteria in the mouth is going to combine with the sugar that you eat. Sugar, not only the sugar that you take in the tea, in the chocolate, in the ice cream, even in the rice, there is sugar. Even in the Irish potatoes, in different kinds of food, we have the sugar in there. Okay? So it's this sugar that combines with the normal flora, the bacteria in the mouth, to form an acid. So this acid combines now with the teeth to form a cavity, a decay, or dental caries. So this is the whole process. Then someone will ask, shouldn't we take sugar? Definitely you have to take sugar, but we need to look at precautions. How do we take the sugar? How do we eat the food? How do we take good care of the mouth? Besides this process, we believe in the science world that the mouth is the dirtiest part of the mouth. Did we know that? It's the dirtiest part of the mouth. the dirtiest part of the mouth. Yeah. So this mouth, our mouth has a lot of bacteria. That's why we call it the dirtiest. We cannot clean the mouth and it keeps free of bacteria. It's always having bacteria all the time, and also it's undergoing a lot of conditions inside, not like any other part of the body. So it's the dirtiest, so we have to regulate the number of bacteria that are in the mouth. So after this has taken place, a bacteria is combining with the sugar in the foods we eat, it forms an acid. Yes? They are not pathogenic. That's what, yes. So we call them normal flora because they are in the body, they are not supposed to affect us. The way everyone here has cancer cells, we all have cancer cells. Okay? But when you reach the extremes that we affect these cancer cells, then they become dangerous to our bodies. Okay? So this is the whole process. And this process, as I've told you, takes 3 years. A minimum of 3 years. Now, from these 3 years, you're not seeing these signs. This process is taking place slowly by slowly. Now, after some time, you start seeing something like this on your teeth. It begins with a white chalky surface. You find someone's teeth has a chalky spot, white chalky. That is the first sign. After that, we shall get this dark stain. So this one, we refer to it as enamel caries. Here there is no pain. It's normal. You can live with your tooth. You're like, oh, I feel there is something in my tooth, but it's okay. I'm not feeling pain. Okay? So when it reaches this stage, there is some little pain. This is periodic pain. Once in a while you get some pain, maybe you may take a painkiller or you don't, the pain will go. Why? You're still in the dentine. Okay? Now, within the dentine here, there are two conditions. Here, you're not feeling that much pain, but when it goes to another part within the dentine still, it proceeds up to here. Okay? Then you start getting much pain, sleepless nights, and all sorts of whatever. So from there, you'll go to the dentist, you want to extract your teeth. That will be the only thing you're asking the dentist to do. Okay? Now, if you're not treating this, you can take still painkillers from here, and this pain goes. Some people are even putting herbs. The pain goes. From this pain, from this stage, the pain will go, but still, it will proceed to this level. Now, this level, you have already entered the pulp. And the pulp is this part that you see here. What is in the pulp? Here you're already in the blood supply. Because it's the pulp that has the nerves that give us blood supply to keep our teeth healthy and growing. Because the teeth will continue to grow as much as we cannot estimate. The teeth grows until you die. It doesn't stop growing. It continues to grow. Okay? Now, it's from this stage, if you neglect this treatment, because here when it comes to pulpitis, in the first stages, there is no pain. For some time, pain will come and go, pain will come and go. After some time, pain ceases. There is no pain, but you have a big cavity in your mouth. Now, from this one, if you don't treat, then you proceed to what we call periodontitis. So periodontitis is a condition, whereby this carious lesion here affects the supporting structures of the teeth. The supporting structures, you have the gum. Okay? So this caries here, it comes within the blood supply and affects this apex, where the blood supply is coming from. So here there is a lot of pain. So if you don't treat from this level, then you proceed to something else. Complications such as Ludwig's angina, then osteomyelitis. So what happens in osteomyelitis? You'll find someone's jaw or someone's neck is swollen up to here. Where did the problem come? The sugars that you are eating 3 years back, they proceeded up something like that. So here we look at the etiology of dental caries. And etiology simply refers to the cause, set of causes, or manner of cause of possession of a disease or a condition. And in the etiology, we have 4 factors. One is sugar, as we have seen, bacteria, susceptible tooth, then time. We have talked about the sugar, the bacteria, now the susceptible tooth, and the time. When you look at that structure, you look at the combination of these four factors. This one, susceptible tooth, time, bacteria, and sugar. So when these four factors combine, they will form caries lesion on your tooth. Something like that. So where does this come in and where does this come in? This and this. We have talked about the sugars, we have talked about the bacteria, the time, and susceptible tooth. So about the susceptible tooth is about the structure of the tooth. Our teeth are not flat, that we can easily clean them, we rinse them, and they keep clean. Our teeth have ridges. You can go back. Look at that. Our teeth are not flat. They have depressions somewhere they're not very straight, others are sharp, others are down. So those differences in the shape of the teeth, they bring about the factor of susceptible tooth. So we have to clean our teeth very well to avoid the possession of dental caries. Because if your teeth is not cleaned very well, then food is going to stay there for some time and destroy the tooth. As we may go back here. So susceptible tooth, the location of the tooth. Most especially these dental caries usually affect the back teeth, the wisdom teeth, the molars, and the premolars. Why? During brushing, we don't focus on those teeth. We only focus where people see. Okay? You know, when you're smiling, people will only see this part. It's where you're focusing. Inside there, you're not focusing. There are a lot of food particles remaining there. So, if you don't focus so well on that, then we are going to get problems with those teeth. And usually, most people start extracting the last teeth, the molars, and they are the most important because they're the ones we use to eat. So if these teeth are not cleaned very well, they are going to combine with bacteria. Combining with the bacteria, they will form an acid. Within the short time, the acid is going to cause us problems. Which problems? The dental caries. That is bacteria. Talked about it. The sugars. These are the foods that we usually take all the time. And sometimes when you're teaching people about this, someone will ask you, I love ice cream. What should I do? I love sugar. I love honey. I love take soft drinks. Usually, we advise people, if you love this, then take them during mealtime. Okay? Why do you take them during mealtime? During mealtime, after you have eaten, the food that you have eaten in the body forms a pellicle. It forms a thin layer on the teeth. So this thin layer is a protective layer that is gotten from the food that you've eaten. So after eating that food, you can consume all this the way you want. Why? Your teeth are not going to be affected. And usually, we advise mothers, if your children are fond of ice cream or honey, let them first have their lunch. You can give them the sweet, and they enjoy. There is no problem with that. Why? The food that you have eaten has already formed a barrier between the tooth and these other soft drinks and the lights that you may eat. So by doing that, you are preventing your children and you yourself from getting dental caries. But we don't literally stop you from taking the sugars. There is also this other factor for mothers, bedtime infant feeding. Usually some mothers, you leave your workplaces, you're very tired, just get a bottle, put some milk, and give the baby to sleep. The baby is going to sleep with this milk in the mouth. You're not going to rinse the mouth. In the due run, the baby's teeth will start to get affected. And when they're affected, when this baby is very young, the infection may continue until 30 years, 40 years, and this child grows up with teeth which are not clear, they are yellowish, they are dark, they have spots because of infant feeding. So the factor of time incorporates all these things. Why time is very important in the possession of dental caries is because the more the sugary substance stays on your teeth, the more the effect. Okay? If you have eaten the sugars, you have not rinsed your mouth, so that time bacteria is accumulating in the area where there are these sugars. So this bacteria is reacting with the sugars, forming the acids immediately, and these acids start right away eating the teeth, slowly by slowly, slowly by slowly. So eventually you will find that maybe 1 or 3 teeth are affected. Why? Because of the time. Usually we have chocolates in our cars, remove eating chocolates till workplace. So this is the time that you spend exposing your teeth to these sugary substances that is going to cause you problem. So in other words, what does this really mean? That you should have less time consuming these sugary substances. If you're going to your workplace, you need to eat chocolate, first have your breakfast. Have the chocolate. After having the chocolate, rinse your mouth, go to your workplace. Okay? But now you'll want to have the chocolate, you carry some chocolate in the car. So that time the bacteria is acting on this chocolate slowly by slowly. Eventually, 1 or 2 years or 3 years, you have a dental caries. You start complaining of pain in the mouth. You don't know where exactly the pain is. Start complaining of sensitivity in the mouth. You don't know where the sensitivity is coming from. But the whole effect comes from the other time you're taking the chocolate. Besides these other factors that you've seen, the 4 factors, are being built up by these other risk factors. This is our day-to-day life. We are doing this maybe because of fashion or something, but they are the things that incorporate with the other 4 factors to cause us problems. And one of the risk factors we have, smoking. It is a very big factor. Smoking is a very big factor. Smoking not only affects the teeth, but affects the whole body. Be it smoking cigarette, puffing shisha, or even this passive smoking, whereby the dad is smoking and the baby is passively inhaling the smoke. It is very dangerous. Why? Smoking causes a condition that we call xerostomia. Xerostomia is loss of saliva in the mouth. There is a reduction in production of saliva in the mouth. So you usually have a dry mouth. Why do we need saliva in the mouth? Saliva is very important. Why? It helps us in cleansing the mouth, cleansing these bacteria from the mouth, and by so doing, it's preventing us from getting dental caries. So when you smoke, you are reducing the production of saliva in the mouth. The salivary glands are being blocked by the smoke, and that's why you will always find people who smoke are having stains around you'll find people who are smoking are having stains around this area because there is a duct that produces saliva in this area. So when it's blocked by smoke, stains will begin from here. From there, they will also begin from this side of the mouth, even that side. Then eventually they will also come around them. But most stains are down here. Why? There is a big duct that produces saliva. So when you smoke, that smoke that you take after some time, it blocks that area. After blocking, then you don't have any preventive measures, because the saliva is the only preventive measure that you have in the mouth that helps to cleanse the bacteria out of the mouth. Okay? Then there is also dry mouth itself as a condition. Usually you have medications that you take, and it's very important that you ask your doctor or a physician that is working on you, what is the effect of this medicine? And that's why people study pharmacy. It's not for granted. If a doctor has prescribed, a dentist has prescribed some medicine, go to the pharmacist. The pharmacist has to explain to you the side effects of the drug and how it is going to treat you, for how long. These are the questions you should be asking. So usually, you will go for a certain condition, you'll be given medication, but the medication is going to cause you dry mouth. And in the due-run, you're treating something else, but in return, you're getting another disease. So you need to ask your physician, what is the effect of this medication I'm taking? And usually, we discourage self-medication because you're used to maybe Panadol or you're used to something like that. You're like, no, I can buy. Usually consult the doctor because you may buy something that is going to cause you problem. And you have reduced saliva in the mouth. This saliva is very important in cleansing action. So if this saliva is not there, then definitely we are going to be at high risk of acquiring these dental caries or dental diseases. And some of the medications that you have here, we have what you call antihistamines. These ones are used in treating different kind of allergies. You have an allergy, you go to the pharmacy, you're like, no, you know my medication I can buy. But they are one of the treatments that cause dry mouth. And if you've been treating any allergies at one time, you must have had a dry mouth. Also, we have beta blockers. These ones are used to treat heart conditions. If you have any heart condition, ask your physician, is this medication very good for me? Yes. Will it affect my mouth? Will it cause this and that? So they should explain thoroughly well and you be satisfied. If you're not satisfied, then you can ask any other pharmacist about that, or you ask for change of drug because they usually have alternative drugs. Instead of giving you this, they can give you something else. Another risk factor are the wound fillings or dental devices. Sometimes you go to your dentist and the dentist fills your teeth. Put something like that in your teeth to prevent the cavity from progressing. But in the due run, that filling gets a leakage somewhere. Okay? You keep eating, you're like, no, my teeth was treated, it's okay. But there is something that is going to bypassing the filling. So in the due run, you're going to get what we call a secondary carie around there because there is a leakage. Then you'll end up extracting the tooth or doing something that we call root canal treatment. So we usually advise people whenever you have a dental issue or you want to fill your teeth or something, after some time, go and check with the dentist. Let the dentist check. Let the dentist take an X-ray to check if there is something. But usually it should be after maybe 5 years or 3 years because we may tell you this is permanent, but it's not that permanent. It is 99% permanent. There is usually some 1% that is left for the leakages and something like that. Then we have heartburns. Heartburns, there are also some drugs which cause heartburns or even the heartburn itself. And usually in the heartburns, we have that disorder, the gastroesophageal reflux discharge. Usually you feel like vomiting. You've eaten your food, you bring back this whole food in the mouth. So what happens is that the food, when you're eating the food, it goes to the stomach. It is mixing with the acids in the stomach for proper digestion. But after a short time, you bring back the food with the acid in the mouth. Okay? So what does this disorder cause? This disorder comes and wears some parts of the teeth. Okay? So if you're doing it all the time, some particles of the teeth start going slowly by slowly, and you're even swallowing these particles. In the due run, you're going to get a condition. You're going to have something like this. This was your teeth. So if this heartburn is so severe, you're taking the medication, sometimes you'll bring back the food that you ate. This is what the acid is going to do. If it continues, it will do that. This is the normal level of the teeth as before, but now the acid has eaten some parts of the teeth. Now, after some time, you have this excess wear, and this treatment is usually very expensive. Same applies to this. I think you've seen people who have something like this in their mouth, even this. And this is also very common. So heartburn, we need to look for medications so that you can avoid something like that. Then also we have eating disorders. You've seen you have anorexia and bulimia. These are conditions usually that cause vomiting all the time. And as we have talked about heartburn, even this vomit that you're bringing back still, it has the acid. So the acid is going to eat away some particles of the teeth, then you get dental caries or you start complaining of sensitivity of the teeth. You're like, the dentist checked, there's nothing, but I'm feeling sensitivity when I'm eating anything or I'm brushing or I'm taking hot or cold. So it could be because of these eating disorders. And usually these eating disorders, there are people, it's you who brings about this disorder. Maybe you want to grow thin, you want to, something like that. There's also not getting enough fluoride. So fluoride is very important for our teeth. The calcium, potassium, and all other inorganic substances are very important for our teeth, but the fluoride is very important. Why? It prevents the teeth from getting dental caries. And where do we get this fluoride? Sources of fluoride. The major source of fluoride, it's the table salt you eat. And that's why I wonder, some people, they're like, my doctor, my dentist told me not to use fluoride, but you're taking fluoride in your salt. Make sure you go back home, you check the pack of the salt. There is an ingredient which is fluoride, and that is recommended by World Health Organization. Okay? The milk that we take has fluoride. Okay? So there are also the seedless resins and also seafood that we are always consuming. They all have fluoride. Besides that, in other countries where they're not having fluoride in water, it's a recommendation by WHO that all this piped water should have fluoride. So if you're not taking enough fluoride, you're putting your mouth at a risk of getting dental caries. Even in some water that we are taking, the water we are taking, the bottled water, there is no fluoride. And we usually recommend you get the tap water, you boil your water and take, because it is rich in fluoride. So the more you take bottled water, the more you're exposing your teeth to risks of having dental caries. But before I told you that too much fluoride, as I've said here, too much fluoride is harmful to your teeth. How do you know you have too much fluoride in the body? Too much fluoride is observed in two ways. One, you have stained teeth. You'll find someone is very beautiful, looking so nice, handsome, but the teeth are stained. They have stains, small dark particles. So this person has a condition that we call fluorosis. So this condition is the condition that is brought about by consumption of too much fluoride. So when you consume too much fluoride, this fluoride makes the teeth hard so that the dental caries, the acid does not easily affect the teeth. So if you're taking too much fluoride, the fluoride is too much, it's going to make the teeth very hard, it becomes like glass. So it is brittle. It is very hard, but it can easily break. So usually people get problems with their teeth. You are chewing something, all of a sudden a particle is out. So you get to know you're having that condition. So what to do for that condition? You are the people we recommend not to use toothpaste that has fluoride. So you're supposed to use toothpaste that does not contain fluoride, and usually that one is indicated there. That is not enough. These are the people we recommend to take bottled water. Company water, manufactured water. Why? It doesn't have fluoride. And also, we recommend them to take minimal of the salt, minimal amounts of salt, and also to reduce on consumption of milk products. So too much fluoride is not good for your health, but you need to have optimal fluoride that can keep your teeth very hard and prevent the dental caries. So another condition, a risk factor, we have teeth wear and tear. Teeth wear and tear. And most of these things, they are based on our lifestyle. It's us who cause ourselves these problems. You find someone, you go to a function or you're at your workplace, they offer you with soda. What you do, you open the bottle with your teeth because it's the hardest body part. Okay? By so doing, there are some particles of the enamel that are being taken away with that bottle top. Some particles are going away. Some time is going to reach 1 or 2, 3 years, your teeth will start turning, maybe black, or it's darker than the others, or it's turning the color. If it's not doing this, there is sensitivity. You take something and you feel there's something, you're like, what is this? you're using you're using your teeth to open bottles, you're using your teeth to cut your nails, most especially ladies. There is also this condition, bruxism, this one. This is a psychological condition whereby you will be sleeping with your colleague in the house, but you feel they are eating at night. Someone is biting. They are biting. This is a psychological problem, but usually we treat it in the hospital psychologically. Okay? You're sleeping with a colleague, or even your child is at home sleeping, but they're always biting, always chewing. You come and check in the mouth, there is nothing. So if they are chewing, these are two hard things. You are chewing, it's like metal to metal, metal to metal. What is going to happen? Corrosion. Some particles are going to be worn away. There are also these acidic drinks, as you have said, the sodas and what. You find someone is very hungry, but they are taking a soda. They have not eaten anything. So this soda is going to wear away some particles of your teeth. People like chewing bones as well. Okay? The bone is very hard. You're chewing the bone with your teeth because the teeth is hard, but still there is some particle that you're going to lose from your teeth. There is also overbrushing of your teeth. Sometimes you want to become, I asked one person, why do you brush your teeth? They're like, no, I want to look clean. I don't want my mouth to smell. But that's not the reason as why we brush our teeth. Someone told me, I want my teeth to become white. Your teeth cannot become white. Okay? They are just in the shade of white, but they cannot become white pure. And even if you brush, they will not turn from the way they look like. We usually brush our teeth simply because we want to have a proper hygiene. This proper hygiene simply helps us to prevent dental caries. So if you have a good mouth, it's very clean, you not have dental caries, you not have bad breath. And that's why we brush our teeth. But you find people are over brushing their teeth all the time, every time they eat something small, they are brushing. We don't recommend this. What do we recommend? You only brush twice, at least twice. And when are we supposed to brush? We're supposed to brush after breakfast and after supper. Then someone asked me, why is it that I wake up? I asked someone a question, why do you wake up early in the morning and brush your teeth? No, my mouth is smelling. Why is it smelling? You didn't brush after your supper. So the bacteria was enjoying the remnants in your mouth during that sleep. And why do we discourage people from brushing during lunchtime, that period? We are discouraging people during this period because the mouth is active. You're talking to people. You're communicating during that time. So it's not necessary for you to brush at that particular time. But the only thing you can do is to rinse with a mouthwash or to rinse with clean water. So we are supposed to brush after breakfast and after supper. And it should not be immediately. Why? If you do it immediately, you are going to corrode your teeth. Because the other thin layer that I told you that is formed there, okay? It is a combination of some factors. So when you bring your fluoride is going to act with that thin layer and it forms an acid which is going to wear away the teeth. So usually we recommend after 5 to 10 minutes of your breakfast or supper, you can brush your teeth. So you can see these are some of the factors of teeth wear. Overbrushing. Some people have this because they are overbrushing their teeth. Overbrushing and also using a wrong brushing technique that everyone almost uses. You just do like this. So this is the condition that you're going to get. And here, some of the root and the crown, they are being eaten away. You see, there is nothing there. So someone with that kind of teeth, they usually have sensitivity. Take something small, hot or cold, you feel there is something sensitive, then you have to first hold your teeth for some time. Okay? Then there's also this, which is very common. I've seen most people with this, but they are not caring. Okay? So time reaches that these teeth are going to be worn away up to this level. That means when you reach this level, there is no smiling, You're not going to enjoy your food. Why? You have broken teeth. Same applies to that. So this one is just an explanation of the gradual teeth wear. It begins slowly, like that, as I've told you, it takes time. After maybe 3 years, you're here. After maybe 5 or 10 years, you're in this stage. And usually when you reach this stage, there are some certain treatments that we do which are slightly expensive depending from where you come from. But according to African standard, you need like $1,000 to treat this, treat that condition. And what we do what we call fronectomy. We manufacture artificial crowns that will come and insert, and they are permanent. Signs and symptoms of dental caries. How do you know that you have a dental caries? We talked about the dental caries beginning without pain, just there. You may not know. But the most common that drives people to hospital is the toothache. It's the toothache. This one drives people. This toothache usually will have spontaneous pain, and this pain is periodic, once in a while. Once in a while you're getting some pain, you're like, okay, I'll take Panadol, okay, I'll take a painkiller. So this pain is one of the signs. If you have pain in your teeth, visit the dentist, check with him. Why do I have pain in my teeth? Then he can do thorough checkup. Then we have tooth sensitivity. Taking something cold, something hot, ice cream, then you start holding your cheek like that. Sensitive, so you first wait for some time until the sensitivity goes. You're having a dental caries. If it's not a dental caries, then you're having something that we call teeth wear. From there, as it's progressing, you can have visible holes, like that one. Visible. Someone can easily look into your mouth and see a visible hole. If it's not visible, then you'll have something like a brown or black or white staining. Okay? If these ones are not there, you can have pain only when you're biting something. You bite something like this, you feel pain. After removing this food or something that you're biting, there is no pain. So usually when you get any of these signs, you have to check with the dentist. Then lastly, we have halitosis, which refers to unpleasant odor from the mouth, commonly known as bad breath. People who have dental caries that have stayed for some time, they have bad breath. Someone comes to talk to you, you only have to do this, or you don't want to stand next to them. Why? They're having bad breath. And if you're married, you know there's no way you can enjoy your marriage if you have bad breath. In some countries, African countries, this is a requirement before marriage. You have to bring a dental checkup report. After the HIV and the rest, you bring dental checkup report. Because there are a lot of conditions that come along, as we shall see, like oral cancers. Someone may be having an oral cancer, so you get married to them, you also contract an oral cancer. So they have brought effect in your life. They have made your life miserable. That's why some African countries, they have made it a requirement that you bring a dental checkup before marrying someone's daughter. So we have complications. Complications. If you have not treated the dental caries, what happens? You're like, no, I'll take a painkiller. No, I can survive with this pain because it's moderate pain. One, we have pain, as you can see. All the parts around the mouth start paining. You start feeling a lot of pain in the head, in the eyes, nose, sometimes the ears. The whole face is affected with pain. If you're not treating again, you're like, no, I'll take painkillers. Time reaches, you have a dental abscess, something like this. Usually affects children. You find your child is like this, you're like, what happened? This is a dental caries. Okay? It was not treated, you're just giving maybe a herb, or you're giving any medication you're giving. It may relieve the pain after some time. The pain is not there, but this one comes after. If you're not treating again, you'll have this swelling or pus around the tooth. You have something like that around your teeth. So if your friend has something like this, they need to check with the dentist, because it's from this and this that we proceed to oral cancers. Not even oral cancers, we go to conditions like osteomyelitis, whereby the jawbone is all affected. And if your jawbone is affected, then you'll need an orthodontic surgery, which is quite very expensive, because an orthodontic surgery, they'll cut off your jawbone and they implant a new jawbone. So we can easily prevent all these conditions if we take good care of our oral hygiene. There is also damage or broken teeth. You'll fail to treat and you have something like this. It's not paining, but you have it in the mouth. In the durian, you'll be biting anything, you swallow a particle like this. Maybe the particle may affect your intestines, it may affect something else in the body. So we can prevent all this by having proper oral hygiene. Chewing problems, you're not going to enjoy your food if your teeth have a problem. Teeth have problem, you're not enjoying your food. You buy your nice meals, but you're not going to enjoy. Why? There is something that is limiting you. There is also positioning shift of the teeth, something like that. This one can be genetic. Sometimes it is caused by the dental caries. If you have a dental carie, it is wearing out slowly by slowly. The neighboring teeth are going to shift. By so doing, the other teeth are being left in space with bigger spaces in between. So they will tend to move where the other teeth are, or they look for some other supporting areas, something like this. So this one, we correct it as well. We come, we first treat the condition. After treating the condition, we correct this one by braces. Can do braces to shift these teeth and they come back to their normal position. So there is also this common kind of cancer, it's called Kaposi's. Some call it Kaposi's sarcoma after the founder, and this is what happens if you have not treated your teeth. This is the late stage, and this is what happens. The earlier stages are not showing. Usually people with earlier stages, they are just having small blisters in the mouth. So if you kiss them and take that liquid from these blisters, you are equally affected. So it is very dangerous to reach this stage, because sometimes you may die even before you reach this stage. It is very complex. It's very complicated, because the flow of the mouth, where there is nervous supply, it's all affected. The nerves are affected. There is no blood supply around this area. Okay, so usually people die before they reach this stage. So some people, by Allah's will, because sometimes you may not determine when people are going to die, Allah subhanahu wa ta'ala may put you there. He will test you with that oral cancer and He still puts you there. It's like, no, I want you to continue living. So with that, you may even get other complications. If those other complications, you may not get them or something, you can have other complications, and these are for life. You can have pain that is going to be there, constant pain. It is going to affect you for the rest of your life. So some people who are not believers will start thinking of witchcraft. And like, no, someone is doing magic, someone is doing black magic, someone is doing this on me, someone doesn't like me. But the whole thing started with a dental carie. There is weight loss as well, tooth loss. So in rare occasions, you have things like a pocket. So these pockets are formed around the teeth, and they bring conditions, as I have earlier told you, like osteomyelitis and Dodwin's angina. So that was brief about the causation of dental caries, the defects of dental caries or complications. Now we are looking at how we can keep our teeth clean. How can we take good care of our teeth? Because this is the most important part. One, brush with fluoride toothpaste after eating or drinking. And we earlier discussed it should be after breakfast and supper that you brush your teeth. As you can see from my pictures, there is this, and this. A combination of this is what we call proper oral hygiene. Not only brushing with toothpaste. After you have brushed, you're supposed to clean your tongue because the tongue carries a lot of bacteria on it. So you have to clean your tongue using a tongue cleaner. And these ones are sold around everywhere in the supermarket. Also, after using this, you need to floss your teeth. You need to floss your teeth. Why should we floss our teeth? Flossing the teeth is very important because when you look at our teeth, it has 5 parts. You have the facial, occlusal, major, distal, then the lingual. Usually when we are brushing, we brush this part here, this part, and this. So what happens in between here, and what happens in between there? You're not brushing. You'll eat meat today, you spend a week, you're feeling something, and you'll always do like, you're feeling something. If you're successful and you remove this meat particle and you put it here, you won't like it till I've started decomposing. So usually you may get dental caries in that place. So we are supposed to brush our teeth, rinse the mouth, visit your dentist regularly for checkups. Not only when you're sick or when you have pain, but you can make it. And as dentists, we recommend twice in a year. Visit the dentist not only for checkup, but also for professional mouth cleaning, because there are parts whereby your your toothbrush will not touch. So you can come, we check, and also help you to clean it. Something like this. Avoid frequent snacking and sipping. And you have agreed we should sip after meals. That's okay. But if it's not after meals, and when I'm talking about meals, I'm not talking about fast foods like chips, burgers, something like that, because they are also included in the possession of dental caries. Eat healthy foods, consider fluoride treatments, drink some tap water. You can see I got this from one of the companies. There is no fluoride in the ingredients. Ask about antibacterial treatments, which are done in the hospitals. Combined treatments, avoid smoking and drinking alcohol. Lastly, as you are concluding, common mistakes when brushing your teeth. We usually take care of every other thing, but we forget about our toothbrush. We're in a new year, according to the English calendar, but you'll find someone has this. They are using this. Why this? These bristles, they are no longer effective on your teeth. So you're just wasting time and spreading the infection to all other parts. So usually a lifespan for a toothbrush is 3 months. Okay? After 3 months, throw. Buy a new toothbrush. Also, not brushing long enough. The recommended time is 2 minutes. So you can time yourself. If you can't time yourself, you buy an electronic toothbrush. It has a timer and it brushes your teeth very well, better than you can brush yourself. So this is an electronic toothbrush. They are sold around. It has a timer, 2 minutes, recommended time for brushing your teeth. And we usually recommend you to brush your teeth while looking in the mirror, so that you can see every other part that you have not touched. Rinsing with water after brushing is not good because we need the fluoride in the water. The fluoride in the toothpaste. Why do we need the fluoride in the toothpaste? To make our teeth healthy and hard. And how do we get the fluoride from the toothpaste? Is by diffusion. Okay? So you have not rinsed with water. After you have cleaned your mouth, just spit. Don't rinse with water. Because when you rinse with water, the importance of toothpaste is no more. Okay? Storing your toothbrush in the bathroom, which most of us do for convenience, it is not healthy. Why? As you're flushing, some particles are going to, they are going to splash on the toothbrush. And this is what we do usually. So we recommend people not to keep their toothbrush, toothpaste in the bathroom. get somewhere else, put this, because even when you put it out of the bathroom, it is going to dry. But usually in the bathroom, it is not going to dry effectively. The top parts will dry, but down it will keep damp. So you're bringing bacteria, which is from the flushing. Okay? You are adding in some other bacteria to your mouth. So you're not only going to get dental caries, but you're also going to get other infections that are brought about by this. That one, not flossing, another mistake. Not cleaning your tongue, as you can see here. Even when you take a soft drink, you'll see the tongue will turn color, but you never clean it. So you may wonder sometimes, your mouth is smelling, you've brushed so nicely. What is the problem? You didn't clean the tongue. If you clean the tongue, your mouth will be okay. Using a hard toothbrush, it's not recommended. We are not brushing to turn our teeth to white or something else, but you are brushing for cleanliness. So when you use a toothbrush, which is very hard, it is going to wear away some particles of the teeth. So these are some of the dental treatments that we have in facilities. Have scaling and polishing, pits and fissure sealants, tooth extraction, disimpaction, tooth conservation, root canal. This is prosthetics. Then we have orthodontic teeth alignment, intermandibular teeth, intermandibular fracture treatment. I think you can ask questions now. Then lastly, we shall watch one video of how to brush our teeth and also some dental treatment and how they work. Thank you. What water? Okay, usually if you want to rinse your mouth, see, Allah subhanahu wa ta'ala has created us with everything we are self-contained, and we need to thank Allah every morning. When you sleep, after you brush if you brush your teeth, let's say today after your supper, you go and sleep, there is a chemical that is formed within the teeth, and this is by the power of Allah subhanahu wa ta'ala. So this chemical is very important for your digestive system. If you wake up early in the morning, you can get warm water, you rinse your mouth with warm water and swallow. So this water has combined with that substance that was formed within the teeth. It goes and prepares the intestines for food. And if you have problems, ulcers, problems, something like that, if you're doing this practice now and then, it will help you to reduce the effect of ulcers. So it is very important. So instead of using mouth rinses, the best mouth rinse, lukewarm water with some salt, you rinse your mouth. So it is not hot, but warm water.
And you're saying to swallow that water?
Yes?
Should you swallow that water or spit it
Now,
out?
that water, the water in the morning that you can use, you get some warm water, you rinse in the mouth and swallow. It prepares the intestine. Usually after digestion, the intestine comes back. It reduces in size. Now you're adding in food. So food is going to push this intestine. And this is one of the causes of peptic ulcers. Why? The food goes and distorts the intestine. The intestine had gone to rest. It is resting. There is nothing in. So this water with the other fluid that is formed within the teeth prepares the intestine. So you're supposed to swallow it. It goes and prepares the intestine. I know most people think it is smelling. Your mouth is not smelling in the morning. You can prove it even after here. You go and brush in the morning. You can blow air. Your mouth is not smelling. It's clean. So you can swallow that water. It's healthy.
Okay, just that when you don't wash your mouth at night, in the morning it will smell.
Yes.
But if you wash it at night, it won't smell.
The morning is not smelling. Any question?
I have a question on a few things. Toothpaste now comes in so many varieties. Before you just bought toothpaste. Now it's tartar-free, fluoride, whitening. It has a whole list of things. So what exactly do you buy in toothpaste?
Okay, the toothpaste that we recommend you to buy is toothpaste that has fluoride as an ingredient. Not toothpaste where they have printed something like teeth whitening. I didn't take about tooth whitening. Why? it is not good for your health. Teeth whitening, it is an act to even do it. It's a treatment whenever you need it. Sometimes there are people whose teeth will turn very dark, okay? And they need it at least to have a normal color. We do teeth whitening. But teeth whitening has very many side effects. One, it will cause you sensitivity for the rest of your life. Okay? If you go and do teeth whitening, you will have sensitivity for the rest of your life. This sensitivity is not treated. Okay? That's why we don't recommend people to buy toothpaste that have whitening, something like that. But the only thing you should look for in toothpaste is fluoride. Does it have fluoride? You buy. Yes? With meat. No problem with meat. The only problem is the whitening. Okay? There is an indication that whitening is not good. Don't buy that one. Only buy toothpaste that has fluoride.
I made my 2 year just 8 to 9 years evaluation. So I'm not feeling any problem right now. You suggest me to check up for the month.
Okay, thank you so much. Depending from where you did the root canal is one of the treatments you're going to see in the video. Root canal is a treatment whereby your teeth has reached that last stage whereby you cannot feel it, so we kill the nerve cessation inside. Okay? Depending with where you did it from and the technology they used. Usually, in some countries which are not developed, they do root canal in 3 phases. The first phase, the second phase, and the third phase. But in developed countries with good technology, it's a one-day thing, maybe 30 minutes. So if you do this root canal and your dentist tells you it's okay, the procedure is done, no more reviews, you can stay like that. But usually, the root canal, the success of root canal, what you call prognosis, is determined after 1 year. If you spend 1 year, you have not had anything, alas.
The root canal they will for me, I mean, they will time around 2 weeks.
2 weeks. So, how many weeks?
So maybe in 5 to 6 cities. If in each and every city they do, they do 2 to 3 hours, and they make something, and then finally they make the okay.
Okay, I would recommend you can go back for review and take an X-ray. See, usually when you're doing the root canal, we are killing the nerves. And that's why in some those countries which are not developed, they do it thrice. Why? These nerves are living organisms. All the time they are growing. So we need to intercept at some level. So they may have intercepted somewhere, then maybe there is something that has remained down. After 2 or more 5 months, you'll still get paid. So you can go for the third review and also ask your dentist or your surgeon to take an X-ray and monitor.
Nowadays, I am seeing also new problem because of the root is going to be thin.
The what?
Thin, I mean very thinner. I mean the root is going to be again,
It's becoming thin?
Yeah.
No, like your gum is leaving the root.
Ah.
Okay? So that is not the problem of the root canal, but that is what we call gingival recession. Gingival recession happens how? Some of these conditions that you have seen. Maybe your brushing technique is not good. And that's why I'm going to play one video and we see how we can brush. Your brushing technique is not good. You're just always pushing, So when you're pushing, good. Okay. So when you're pushing like that, it depends on the way you're doing it. But sometimes the brushing technique, if it's not good, it will push the gum away from the teeth.
Some people get up and have coffee and tea first thing in the morning. Is that damaging to your teeth?
It is damaging. You see?
First thing they have is
Yes.
coffee and tea.
Yes, you're not supposed to take anything hot in the morning as the first meal. Okay? As I've earlier told you, the intestine is sleeping. It is hollow like this. Now it has reduced its size. Now you're pouring, something hot inside. It is going to disrupt it. So partly of the muscles of the intestine are going to be worn away. In the long run, after some time, you may complain of ulcers or any other condition. So usually we recommend, okay? If you wake up early in the morning, the only thing you can do, take lukewarm water, rinse with something that was formed at night from your teeth. Why? This is medication that the Almighty has put in the mouth. Help us prepare the intestine, then you can take your tea after that.
How about when you're fasting, like around fasting? You break your fast totally, and then you break it with lemon, you're drinking lemon and honey before you eat your meal.
Before you eat your meal?
You take dates and you take...
Yes, and you see, most of these things we are studying, they are from Islamic perspective. Usually we don't recommend someone to start with food. You begin with water, dates. Those are the soft foods, and they are very also important for the body.
So you break your fast, drink water first, not dates.
Yes. Even in the morning, you can wake up, you're not fasting, you can eat something that is fresh. You usually want someone to eat something that is fresh, not prepared. You can take a fresh fruit, you can take a date, something like that, but not prepared.
So some what I'm not very sure, but I have seen so many places they pastry. Early morning they're taking the fast when they get up, then take the tea. Then it's not good.
Yeah, it's not very good. It's not good at all because it will affect your teeth. And also, such people who are having that culture, their teeth don't look like ours. Their teeth are stained. They are having certain kind of shade that is not normal. And also, this is not good because you're literally affecting the pulp. The pulp which brings the nerve supply, you're affecting it by this hot tea that you're taking in the morning. In the urine, your teeth are not going to be vital. They are going to be dead teeth in the mouth.
Okay, Bridging, and why, when do you need it, and why do you need it?
Okay, thank you so much. Bridging is the dental treatment that we do if you lose a tooth. Okay? And a recommendation before you do bridging, you should be 25 years and above. Okay? Yeah, and I've got a problem. People ask, why do you missing the tooth and you're a dentist and what? I've not reached the 25 years limit. So it's a recommendation. You first reach 25. Why? Because your jaw is still growing. So if you put a bridge before your 25 years, your bridge is going to wear out. So the dental bridge, it is a simple treatment that is a replacement for an implant. If you cannot afford an implant, you do a bridge. And how do they do a bridge? These are your teeth. These ones are the teeth. You lose this. Okay? So we shall manufacture a tooth that fits here. How do we manufacture? Before we manufacture, we trim part of this and part of this. After that, we measure the size of these three teeth inside. So these ones which are coming, this one will come as a cup, and this one as a cup, this one as a full tooth. So we join inside there until the gum line. So that is a dental bridge. And it's also very important if you're making teeth, because if you're brushing your teeth and this one is not there, food particles are going to stain on this part of the teeth, even on this part of the teeth, and you cannot easily clean here. Even if you put a floss, there is no supporting tooth. So you're going to get a problem. That is not enough. You're going to get a problem of drifting. This tooth would want to make with this. They will come like that. That is not enough. The opposing teeth down, as I've told you, teeth continue growing. You'll get a condition that we call supraeruption. The opposing teeth is going to move looking for another teeth because teeth have been made that they should be meeting, they should be in contact. So if you lose one teeth up, the down one will continue to grow after some time, maybe 5 years. It will continue to grow until it gets where its contact is. So it is very important to do teeth breaking.
So, and the bridging, is normal to put into it, or you have to take it and...
The bridge is permanent, you don't remove it. You brush normally, there is nothing else that changes, just like a normal tooth in the mouth. The same applies to an implant. The normal tooth in the mouth, you can brush, you can eat nicely, no problem.
So my last question is, how do you store your toothbrush? Should we buy toothbrushes that are cast on it, or local?
Okay, according to what you feel like, but a toothbrush, usually what we recommend you to have, it should be stored while standing upright, so that the water inside drips slowly by slowly and it dries. Okay? Then in the morning, before you even brush your teeth, you're actually supposed to first wash the toothbrush with clean water, get water in the mouth, okay? Rinse, first brush without toothpaste. Okay? First brush without toothpaste, straight, rinse your mouth, clean the toothbrush thoroughly well, then you put some toothpaste, again you continue brushing.
Okay, what about that the fourth plate?
Yes? Yes?
The fourth plate, the one I'm saying they remove it, you wash your mouth.
Okay. So those ones are that's all technology. Those ones we call them dentures. It's all technology that you can remove a denture, you keep it in water, that's all technology. And also depending with your pocket. Your pocket can afford a denture is removable. Okay? When you're going to sleep, you remove the denture, you keep it in water, which I wouldn't recommend people to use because sometimes you may forget your denture, it will break. You may have a denture, it may break maybe 10 times in the year. So the amount that you'll spend to repair this denture makes a bridge. So simply make a bridge, or if you have money, you can make an implant. If you lose a tooth.
What's the difference between implants and a bridge?
Okay, the implant and the bridge, the difference is the way we insert. For the implant, we drill the jaw. We drill the jaw. After drilling the jaw before it dries, we insert a screw. Inside this screw grows with the bone as it heals. Then later on, we manufacture a tooth that has a screw on top. Then we tie it there. Those who have done the procedure, I think you've seen how it's done.
Where that tooth is coming from? Is it human tooth?
Which one?
The teeth we are going to fix there again. Where is it coming from? From animal?
Oh, we manufacture the tooth from material that slightly looks like the tooth.
What about the stains in the teeth? How do you clean it? How do you
Your?
the stains that are already in teeth?
Oh, the dirt.
Yeah.
So when you have that in the mouth, your mouth is stained, you can do what you call professional mouth cleaning. You see the dentist and he does scaling and polishing, as you're going to see in the video. So this is about dental treatment. Those are braces. That's how they cause their effect. If you have braces in the mouth, you lose a tooth. Now that is a bridge that some of you have been asking about. That's what we do. That's a bridge, permanent. That one they are doing, we call it a crown. For those people whose teeth have broken to some level, put a crown. Implants. So that's an implant. That is normal filling of a cavity which has not proceeded its level. We are filling it with cement. That is the dirt that is already in your mouth. So that's how we clean it in the hospital. Expansion screw. Sometimes their teeth which are down and they are blocked, so we expand and create space for them. Root canal. So we remove, that is the nerve which is being removed from inside. The whole of it has to be removed totally. Yes. Then we fill with the material that we call gutta pacha inside. So sometimes you'll have screws. We put screws if the tooth structure up is not looking good, it's all distorted. We put screws and put a crown on top. These are braces still.
And brushing in a pattern. It's important to brush at least twice a day, after breakfast and before bed, using a soft toothbrush. A soft toothbrush also makes it much easier to remove the plaque below the gum line, where periodontal disease starts. Use a pea-sized amount of toothpaste that contains fluoride. It might stop a cavity in its tracks and give you more resistance to future cavities. Angle the bristles of the brush along the gum line. At a 45-degree angle, apply firm pressure so the bristles slide under the gum line. Vibrate the brush while moving short back and forth circular motions. Brush 2 or 3 teeth at a time. Then move to the next teeth. Tilt the brush and use the tip to brush the backs of the front teeth. It's fine to brush in any regular pattern you choose, but since the insides of the teeth tend to get less attention, you might start with the inside of the upper teeth, then go to the insides of the lower teeth, switch to the outside of the upper teeth, and then the outsides of the lower teeth. Brush the chewing surfaces of the upper teeth, then the lower teeth, and end by gently brushing your tongue and the roof of your mouth. This removes germs and keeps your breath fresh.
So that's brushing. Lastly, it's flossing.
There are three types of glasses.
Yes.
Soft, medium, and hard.
Yes.
There are three types of glasses in the market: soft, medium, and hard. So how we know that which for which is suitable for which?
Okay, thank you. The hard toothbrush, forget about it. Maybe you can use it to clean shoes and something else. Soft toothbrush is the one we recommend. But if you have tartar or you have canicula's around, you have dark stains on your teeth, then you can use a medium toothbrush. So we recommend a soft toothbrush. So this is flossing.
And most of us don't do it enough. That could be because we don't know the proper way to do it. Take a minute and follow these simple instructions. Take about 18 inches of floss and wind most of it around the middle finger of one hand. Take the rest and wind it around the other middle finger of the other hand. Pinch the floss between your thumbs and forefingers, leaving 1 to 2 inches in between. Gently guide floss between two teeth by using a zigzag motion. Do not snap the floss between your teeth. If the floss is hard to get between your teeth, ask your dentist or hygienist about the variety of floss holders or interdental cleaning devices that are available. When the floss reaches the gum line, curve it into a C shape around the side of the tooth. Slide floss up and down against the tooth surface and under the gum line. Repeat for each tooth, including the backside of the molars. Floss each tooth thoroughly with a clean section of floss. Flossing every...
So that is flossing. Thank you so much for coming. See you next time.
Very nice video. No, nice lecture and just we got so many things from you.
Okay, thank you so much.
Allah subhanahu wa ta'ala.
Very much.
Welcome.
Can we